And everybody's story is different. Like you think breast cancer and, you think lumpectomy or mastectomy and you think, okay, well, they had a lump removed or they had a breast removed. But everybody's story is different. How they found it, how they were treated during treatment, the things that the doctors said or didn't say, the resources that they don't know about, honestly. Like there's so many resources that people don't even know about out there. And to me, it's sad that women have to go through all of this. They have to be their own advocate on top of such a life-changing thing, because everyone I know says that it's changed their life.
I'm Candace Dudarty. This is Gratitude Geek, the podcast for micropreneurs building genuine, lasting connection with clients, colleagues, and community. Today, we sit down with one of my best friends, Christy of Going Forward Therapies. Christy is a licensed massage therapist, reflexologist, and aromatherapist with 12 years of experience. She helps clients heal energetically, emotionally, and physically, especially during breast cancer recovery. Welcome, Christy.
Hey, Candace.
We have known each other a very, very, very long time.
Mm-hmm.
Do you want to share with the audience how we know each other?
Wow. So a friend introduced us over some cards. I was looking for a way to market my business. And he told me that he knew somebody who could help me send some cards and stay in touch with people and that I could maybe make some money at it. And I was like, how am I going to make money sending cards? And so he connected the two of us and we were fast friends and we've been together ever since.
Yep.
I think going on 10 years now.
Could be more than 10 years. I think I started marketing those greeting cards in 2012. So it might be more than that. I still use that system. I don't market it so much anymore. I mean, I'm still an independent rep. And y'all, if you are interested in a greeting card business and you want to learn more, the link will be in the show notes. I'm not going to name the company because then I have to say that the show's sponsored. But there'll be a link in the show notes. I remember going with you I think we went to Vegas. This is to speak towards your expertise, and then we'll move into your story. We went to Vegas, and you said to me, would you like me to give you a reflexology session? And it was right before bed. And I was like, I'd never had a reflexology session before. I was like, sure. And as you're massaging my feet or whatever it is that you do as you're reflexologying my feet, you say to me, something going on with your kidneys or your bladder? And I was like, no, I don't think so. So you just continued to do your thing. I swear to God, that night I went to the bathroom 4 times in the middle of the night. So whatever it is, you fixed it that I didn't even know I had.
Funny.
I was probably retaining water or something.
So actually, you know what that was? We were in Utah at a convention for that greeting card company.
Were we in Utah?
But that's
okay.
Hilarious.
I can't remember. Have we ever gone to Vegas together?
I don't think so. I've never been to Vegas, so I know we've never been together.
Well, that's funny. That's funny. Okay, so tell the audience your story. How did you become a breast cancer specialist within the holistic wellness genre?
Well, so my journey with breast cancer actually started back in 2024. My mom's best friend was diagnosed with breast cancer. My little one was about a year old, and my mom's best friend was diagnosed. I went on to be one of the top 200 fundraisers for Komen that year. So I took my mom to all the events. Sorry, now I'm going to get emotional. Didn't think that was going to happen. So my mom lost her best friend a month before my daughter was born. So things have come a long way since 2008. But then over the years, I met you. We've got several mutual friends and, that also have their breast cancer thrivers. Currently, I am working with a woman at her location, and she just went through a mastectomy in January. And then we have other clients that have had either breast reductions or lumpectomies. And I just really wanted to be able to help these women that I hear. And everybody's story is different. Like you think breast cancer and, you think lumpectomy or mastectomy and you think, okay, well, they had a lump removed or they had a breast removed. But everybody's story is different. How they found it, how they were treated during treatment, the things that the doctors said or didn't say, the resources that they don't know about, honestly. Like, there's so many resources that people don't even know about out there. And to me, it's sad that women have to go through all of this. They have to be their own advocate on top of such a life changing thing, because everyone I know says that it's changed their life. So I personally have not gone through it, but I love that I have such a community of people that I can go to and say, okay, so what was your experience with this? What was your experience with this? And they know that I genuinely care enough to tell me what they went through. You and I have talked about the difference in being in two different locations going through treatment, and the difference in the mental health aspect of the help that you didn't receive necessarily when you first started this journey. It was more your friends and family that you were having to depend on, where once you moved out of state, that was completely different scenario for you. So, there's just so much to it, and there's so many things that we can do to help women that are going through this.
Yeah, we have a very non-standardized quality of care in the United States. I was diagnosed in Texas. The very first oncology treatment center that I went to had a place where I could go and get my pedicure and a manicure done free of charge. I get my hair cut there free of charge. It was very luxury, very glamorous, but they had not the best billing practices in the world. And that company went out of business, actually. But I left before they went out of business, and I moved on to a different oncology center, still in Texas because I hadn't moved. And
Mhm.
it was that same, felt like, I mean, everybody who worked there was very, very kind, but I always felt like I was stuck in a sardine can during treatment. And
Mhm.
then when I moved to Michigan, here at the cancer center where I've been going for the last 8 years, I have my own little suite, my own little cubicle that has 2 chairs for visitors. So 2 people can come and visit me and sit with me, but there's enough room in there so that more than two. But there's 2 chairs in my cubicle. I have my own TV. At the other 2 cancer centers, if their TV was on, it was on with usually really toxic news or something or even worse, like one of those reality TV shows where you are the father kind of shows.
Oh, uh-huh.
One of those kind of shows. And here, I don't even turn the TV on. Now, sometimes I bring a book to listen to on my phone, or, I always have a little project to work on. And sometimes, I know a lot more people try to visit me in Texas because I had a bigger friend group. But here, I just enjoy the 2 or 3 hours that I'm there having my own a little alone time. It's a completely, like I said, the quality of care in the United States is very non-conforming. You could go from city to city, from state to state, and you're going to receive different levels of care. It's very, very interesting. Even the difference in the quality of care. Here's an excellent example. I'm hogging your interview, but
You're good.
same same hospital system. So I had my breast lumpectomy in downtown Houston at a hospital that was owned by the same company that I went to when I had an infection and ended up staying in the hospital for 5 days, a couple years later, right? The quality of care that I received at the downtown Houston hospital,
Mhm.
owned by the same company as the hospital that I stayed at in the suburbs, night and day. The downtown hospital, I felt like I was a queen, right? I was
Oh,
so well taken
wow.
care of. The suburb hospital, I asked 3 times for them to help me take a shower. I was in a position where I couldn't. I asked them 3 times to help me take a shower, and n- I went for 3 days without a shower,
Oh,
even though I
wow.
asked multiple times to take a shower. I mean,
That's horrible.
that's just something that should have been, if your patient asks you to take a shower, for number
Mhm.
one, when you take a shower, you feel better. You know?
Mhm.
Number two, I couldn't do it alone because I had all these wires and everything, and they needed to be covered and all this stuff. I couldn't do it without help. But still, they could have, my husband's here. He can help me take the shower, but can you set it up so that I can actually take the shower? It was an eye-opening experience for me because I thought that I was going to get the same level of care that I received in downtown Houston in the
Oh,
medical
wow.
center. So yeah, isn't that fascinating?
You would think, though, that a shower over 3 days, like, that's something that they would be proactive about too.
Yeah.
Like,
Yeah.
I mean, it's just one of those things that you would think, I mean, it's kinda like you having the little tray in case you get sick. A shower would be, to me, something intuitive that you would want to do, right? I
Yeah.
mean, most people don't want to when they're feeling really bad, but once they, start to feeling a little bit better, most people want a shower.
Yeah. Yeah, I had a doctor come in to check on me, and I was like, "I have to go to the bathroom. I need you to help me go to the bathroom." I had a very, very bad infection, and I could barely move without help. So, because when when you have the inflammation from an infection, it's just you're in
Mhm.
so much pain. And so a doctor actually helped me go to the bathroom because none of the nurses were available to help me go to the bathroom. That was how bad it was.
Wow.
Yeah. Huh?
That's crazy. So going back to your treatment room though, there, I think it's interesting that you're actually able to do some self-care while you're actually getting your treatment.
Yes, I
That's
am.
so cool.
Yeah. Uh-huh. Yeah. If I want to talk to the person next to me, we can see each other and we can have a conversation. Like I do have a chemo friend, and if she's there and I'm there, I'll sit next to her so that we
Mhm.
can chat. For the most part, I have my own little space and my own little world, and I don't have to talk to anybody if I don't want to.
Oh, wow. That's
Whereas in
awesome.
whereas at the cancer centers in Texas, I was literally sharing a table with the person next to me. You remember, you came and visited me when I was in treatment,
That's what
didn't you?
no,
You didn't?
we didn't know each other, when you first started that journey.
We didn't?
Nope, we met after.
See, I thought we knew each other before.
Nope.
Oh, Candace, focus. So imagine that you're speaking to someone who is just newly diagnosed. You do have a suite of modalities that you can recommend to somebody to help with their side effects and whatnot. So, which of those modalities surprises you the most?
I would still say reflexology.
Really?
No, I don't know if it's because it was my first thing, my first introduction to the holistic therapies, but the reflexology, it's non-invasive. No, you don't have to disrobe. You don't have to do anything but sit back and relax. Take your mind off of everything. Where, a massage, you have to disrobe. Not that there's anything wrong with that, but to me, when you're going through that first diagnosis, you've been through, mammograms, and you've been, for lack of a better thing, you've been poked and prodded and exposed and very vulnerable. So the reflexology gives you a chance to have some help and some relaxation without having to do any of that.
Mm-hmm.
Even the hand reflexology, just showing somebody some basic points for relaxation on their hands is very helpful because, you never know where somebody's at. I would never tell anybody not to do what is recommended by their doctor. I would just encourage them to do what they feel is best for them, and different people take a different route. I want people to feel empowered to do what they feel is best too. But I want people to get all the information. And I think everybody should have somebody that can go with them,
Mm-hmm.
whether they want to or not. 4 ears are better than two.
Mm-hmm.
And when you're first told something like that, I think you immediately kind of shut down. So to have somebody else there with you, no matter who it is, if you don't want to take your spouse, don't take your spouse. If you don't have a spouse, take a best friend. If you don't want to take your best friend because you know your best friend is going to be protective of you, take an acquaintance.
Yeah.
Somebody that you trust, ask somebody to take notes.
Yeah.
Maybe it's a coworker that you love how they take notes and take care of their responsibilities at work. Just because having somebody else there with you to help take notes and, because later you're going to be like, what did they say? Wait, did they say that did they say I need to do 6 rounds of chemo or 9 rounds of chemo? Like, did they say I need to do chemo? Did they say I need to do radiation? And having somebody there to help you take those notes and be those extra ears, somebody that you trust who's not going to tell you what to do. Because I
Mm-hmm.
think that's the important thing. I think when someone has any type of diagnosis, you don't need to be told what to do. You need somebody to be there for you. And I think that's like a really important thing.
So something that exists now that didn't exist when I was diagnosed, or
Hmm.
when your mom's best friend was diagnosed, is you can have an app on your phone record the conversation, and then the app on the phone will synopsize the conversation. So something that my family practice doctor does now my doctor doesn't do it, but other practitioners in our office do it. So they'll put their phone on the counter during the meeting, and they'll record the meeting, and then the medical record notes are automatically transcribed and added to the chart, the
Oh,
patient's
that's
chart.
awesome.
Yeah. So there is in 2025, if you were diagnosed, there is nothing stopping you from recording your conversations with your doctor so that you can go back and listen to them later, or you can have whatever AI synopsize the conversation so that if you do, and you could upload those audio. Oh my God,
Hmm.
I cannot stop raving about Notebook LM. It is my favorite research tool. It's an AI tool created by Google. You can upload the audio recordings from your doctor visits to Notebook LM, and then you can literally ask Notebook, what did Dr. So-and-so say about XYZ? And it will listen to your conversations, and it'll tell you exactly what the doctor said.
Really?
It is
Oh,
the
wow.
best tool. I use Notebook LM every day. I use it to figure out what my past podcast guests have done in my network marketing business. I use it to come up with nifty little things that are within the guidelines of the company. Because you never want to, when you work with a network marketing company, you never want to say something that isn't what the company tells you can say, right?
Mhm.
Even if you believe in your heart of hearts that your product cures cancer, unless the company says you can say that it cures cancer, you cannot say that it cures cancer, right? So
Well, yeah, I mean, that's the same thing with me as a massage therapist and reflexologist. No matter how much I believe, no matter what I've seen, I can't claim that this work does anything.
oh,
I don't diagnose. I can tell people, like you said, I asked, is there something going on with your bladder? Is there something going on with this? But I can't say, hey, I think such and such and such and such. No, because that's not what it's about.
and going back to that story, you said, has something going, I can't remember if it was kidney or bladder, but you said, is there something going on with your bladder? And I said, I don't think so. And you said, and then you continued to do your, and you didn't say anything else.
Mm-hmm.
You didn't say anything else because you know your job, and your
Yeah.
job is to provide your service. You
Yeah.
provide your treatment, but you don't diagnose.
Right.
You are so good at your job. You also have magic hand. You've given me one of your Swedish massagers.
Mm-hmm.
As a cancer patient, I do not want someone giving me a deep tissue massage because I don't want them moving shit around in my body. The way that you massage, Swedish massage.
It's funny, I was in a class just last night and we were talking about that. We were talking about studies about whether or not this particular modality actually moves cancer around. And they were saying that really there haven't been any studies that prove that, but we were talking about lymphatic. And lymphatic work is not deep work
Yeah.
because your lymphatic system is not deep
Yeah.
in your body. So
Yeah. It's
so
right
we
on the
were talking.
surface.
Yeah. So we were talking about, the benefits of lymphatic work when you're going through treatment, but they do say like 12 weeks out. And, there's some different things and there are some contraindications. But, for the most part, just because someone's going through treatment doesn't mean that they can't have some of these modalities, some of this work done. Because I know, some people are scared.
Hmm.
I think it's just, again, doing what you feel is best for you. Obviously check with your doctor, make sure that it's okay for you to do it. And most doctors will tell you there's certain things that you can do, but you need to wait so many days after a treatment. And that's reasonable.
Yeah. So one of the things that I did after the really horrible treatments, the second round of chemo, the ones that made it impossible for me to walk for 3 days afterwards, I would
Oh,
go and
wow.
have acupuncture treatment done the next day. So my husband had to basically, he couldn't carry me into the room, but it was very difficult for me to even walk. He would take me, help me sit down in the chair and back in the chair, and I'd have an hour of acupuncture. And that helped. I did acupuncture both rounds. So the first round and the second round. And I never vomited. I
Really?
never got nausea. And I think that I really think it was the acupuncture. Because that's what she did. She helped. She did relaxation, nausea, and pain. The pain was. It didn't matter how much acupuncture I did. The pain was beyond. It was unbearable. It was nervous system pain. So my neural matrix didn't function for 3 days
Mhm.
after the treatment. It was Abraxane. Oh my god, it was awful. Okay, I mean I'm alive today because of that Abraxane. So reflexology, we have talked about it, but we really haven't explained what it is. So
Okay.
there may be people in the audience who don't know what reflexology is. So please just give a broad overview of what it is.
So reflexology is normally done on the feet. The Reflexology Association does say that it's feet, hands, and ears. The complete body is mapped out in those areas. I say that reflexology is a massage on steroids because when you get a massage, You're working the integumentary system, the skin, and the muscular system. Typically, those are the two systems you work with massage. When you do reflexology, you are working all of the systems of the body. So there's a protocol that most of us follow, and then there's a relaxation portion to it, and then we go through each of the systems of the body.
And it works on the feet and the hands.
So typically, I don't do the hands. What I use the hands for is to show people what they can do on their own time. So I'll do the full session on the feet. And then say someone has a shoulder issue. Well, your shoulder is here underneath. So I'll tell people, okay, next time you're riding in the car with your significant other going somewhere, you're sitting there watching TV, just move this up. And, some people will tell me, it's so weird. I've been doing that. I didn't even realize that that's what that was. And that's what it is. They're trying to relieve that pressure on
Because
their
our
shoulders.
bodies know. So do
Yep.
you do it on the same side that hurts?
Yes.
So if your shoulder hurts on this side, then you should do this
Hmm.
pinky finger.
Yep.
So if you're not watching the video and you're listening to the audio, Christy is talking about the right underneath the joint where your pinky finger and the pad underneath the pinky finger fold, about pushing just gently using your thumb to push up very lightly into the fold of the pinky. Am I correct?
Yes.
And
Exactly.
that should help relieve some shoulder pain. How did you know my shoulder was bothering me right now?
I don't know. Energy, energy. And it's funny. I know people who've trained as reflexologists who do not like to do reflexology because they feel like they can't ground well enough and they get physically sick when they
Mm,
do it. And they
that
can
makes
do
sense.
any kind of thing. For me, I don't take that on, but like I'm drawn to go back to an area. So that's why I asked you about your bladder or kidneys that day, is because when I worked on it the first time and I went through, and then something told me, go back and work on it again. And then, it was just intuitive. So, and the shoulders is a big one. A lot of people, that's where they carry their stress.
Hmm.
I mean, of course, the old saying of, you carry the weight of the world on your shoulders. It's true. Most people do.
It's true. It's true. Yeah. A lot of times headaches are caused by neck pain. So yeah, there's a lot going on there.
So it's funny that you mentioned acupuncture, because did you know that the newest tool that I'm working with is based on acupuncture and microcurrent?
Really?
Yes.
So
So,
tell me about that tool. Is it a machine? Because I know that we haven't actually had a sit down. Okay, full disclosure, you are one of my coaching clients as well.
yes.
The clients, colleagues, and community. And one of the things that I am really focusing on going forward with my podcast guests is the disclaimer of how we know each other,
Mhm.
because I want the audience to understand how I build my community, how I find my guests. You're in Robusta, which is the group coaching program. So you've
Mhm.
been sharing the new systems that you're building, but you and I haven't had a conversation about exactly how the systems work. So
Right.
I'm very curious. How does this new modality work like acupuncture?
So it actually has like well, I use two because I purchased it so that I could do the scar work. But it's like a pen and it's a microcurrent, and a lot of the pain relief protocols, a lot of the protocols are based on acupuncture points. So it is one of the few modalities that I typically will keep the book out with me whenever I'm working, just because I am not an acupuncturist, and that's a lot of points to try and learn. So
Yeah.
I do keep my book out for that one. I haven't memorized all of those points. I've memorized some of them, but not all. So, but I love that is one of my favorite tools. The scar work, to be able to help somebody with their scar, and not, some people, they love their scars. Their scars tell their journey. And whenever talk about scar work, I never want to take that away from someone, but I do want to help energetically reconnect their body so that those adhesions underneath are not so tight, so that their body can, the lymph can flow, the energy can flow. Acupuncture is based on traditional Chinese medicine. So,
Mhm.
you know, it's all about energy.
6,000 or 10,000-year-old, that's a very long time for it not to work.
Right.
If they've been practicing something for that many thousands of years, there is
Mhm.
something about it that actually works, right? So my mother's Asian, but she completely rejected everything Eastern. She was like Western medicine only. She didn't believe in Eastern medicine. And I don't know if there
Really?
was something child related or or some or just that she just wanted to be an American, right? I don't know.
Mhm.
I don't know what that was. So I didn't know anything about Eastern medicine because my mother just completely rejected it. But one of the blessings, I guess you could say, of this breast cancer journey that I've been on is that I learned about these modalities. And there are some that I'm like, what? And there's others that I'm like, that works. Like I fully believe in the power of aromatherapy. Because
Mhm.
when I have indigestion and I put peppermint oil in a carrier oil on my belly, the indigestion goes away, right? It works. So, and those modalities come from many, many different cultures. I mean, many different cultures use peppermint oil for indigestion. Not, it's so, they just work. Anyway, go
You know,
back
you
to
can
this
use lemon
argument.
oil for that too.
Peppermint oil works. So I'm going to stick with what I know works.
So it works for you. You know, like peppermint oil doesn't work so much for me, but
Really?
lemon in the carrier oil, every time.
Really?
It'll help every time for
I have
me.
some lemon oil
Yes.
coming. I've actually started buying the larger bottles of essential oil instead of the smaller
Mhm.
bottles now. And I have 6 that I keep that are my 6 core oils, and I have lemon coming because I just ran out of lemon. So will be the first time I've had the big bottle. How about the big bottles now?
Yep. That's good though. I mean,
But
you know,
yeah, I use
I
them every
love the
day.
essential oils.
I don't I don't have a particular brand that I recommend, so don't ask.
I don't either. So, and I do my own blends and I change it
Yeah.
up, you know.
Well, that's something that I learned from this was before I met you. I learned from an aromatherapist before I met you about essential oil blending. And it was so interesting because I love blending my own oils. I'm constantly looking up recipes for, hey, there's a lot of smoke in the air because I'm on the Canadian border. So we have a lot of smoke. It's not every day, but when it's really smoky and even though all the windows are closed, it still feels smoky. I have 2 very small nodules of cancer in both one in each lung. So breathing is difficult for me. Audience, in case I don't really talk about that. So when it gets really smoky, I need to purify the air. So I looked up air purification essential oil recipes, right? But I learned that before I met you, but then you actually taught me. I mean, she would just blend for me, but you actually
Mhm.
taught me about it and about the high notes and low notes. Yeah, and now I love aromatherapy. I am squirreling hard today. Do you know why? I'm not wearing my patch. I needed to
So
put my
in
focus patch on this morning.
mm,
I didn't. Okay, go on. Sorry.
so that was going to be my question is which one do you use for that?
When I squirrel,
Mhm.
focus. Yeah, I use. So we're talking. Okay, now I have to make this a sponsored. I have to turn on the little sponsored button now, but I'm going to do it anyway. I introduced Christy to the super patch a couple years ago because I knew that it would be a great tool for her in her business. But I use them because they help with inflammation, which is a side effect of cancer treatment. They help with my squirreling, which is because I have
I have
ADHD.
idea.
I have ADHD. It's pretty obvious today that I have ADHD. And the inflammation though was the number one thing. I didn't realize just how bad it was until I started using these patches because they really, really helped with inflammation. So there will be a link in the show notes. You know what? I'm going to use Christy's link in the show notes.
Appreciate that.
There'll be a link to Christie's Super Patch store in the show notes. And the 2 patches that we were referring to are Liberty for the inflammation and Focus
Mhm.
for the swirling. Okay. So,
It helps a lot, and you definitely see the difference, and
mhm.
there's nothing in them. I
No,
love that there's nothing in them,
they
you
kind
know?
of work the same way that acupuncture, acupressure, and reflexology work
Yep.
through the neural matrix.
Mhm. Exactly.
All right. So,
So there so I don't feel like we've squirreled. What
okay.
I feel like we've done is part of what we were gonna talk about is how to incorporate these different modalities and different things that we do, that I do, and I think we've covered several of them in just a conversation. So really and truly, is it a squirrel? I don't think so. I think it was all intentional
It
or
feels like a
unintentional,
squirrel.
but
It feels like a squirrel because you were gonna start talking about this new tool that you're using, and I got us off track. So share about this scar reduction tool that's based on acupressure.
so it's the same thing, same one that I use for the pain. You know, there's pain points that you can do. There's points that you can do for focus, anxiety, depression, to help with the parasympathetic system. There's ones for neck release. Funny enough, on Monday, I was leaving my boyfriend's house and he has a grandson. The grandson and his mom were at the house and she said, Christy, what can I do? She'd already asked for like the massage tool. And she is like, what else can I do? Well, I happen to have that with me because I was going to I worked on my boyfriend's scar. And so I did the parasympathetic reset points. I did 3 points for the parasympathetic. And then I did just with those 3 points, she had a crick in her neck is what happened. And she couldn't barely move her neck. I did those 3 points for the parasympathetic. And she was like, what is this magic that you are like, what are you doing? I said, it's acupuncture. I said, it's using acupuncture points without the needles. And so then I did the neck release on both sides. And she was like, this is crazy. How does this work? So then I had to explain, what acupuncture is, because she's a young lady. She doesn't know a lot of this stuff. But yeah, so it works on the acupuncture points for the pain. The company has the concussion protocol, which is good for people with TBIs and head injuries. But the scar work, I love. I
And it's
love
the
the
same
scar work.
tool does both.
Same tool for all of it.
So how does acupuncture reduce scars?
So what we do is, okay, so when you have, so this is before surgery, right? Everything's flat.
So
And
she's got
then,
she's got her fingers pushed together and it's flat. Try to
so,
describe it.
oh, okay. So I forget. So because I can see you, I assume that everybody can see you, but then I forget that it's actually audio too. So I've got both my hands together. So they're flat and it's going flat. So then when you have surgery, they're cut. So I'm pulling my hands apart. And then whenever they sew it back together, now I'm putting my fingers where they're going inward and I'm putting it back together. So now you've got the adhesion underneath and you've got this dip in front, right? This is the top of your skin when you have any kind of surgery. Doesn't matter what kind of surgery. So then this particular tool, what it does is you work along the edge of the scar with the microcurrent, and it's making that adhesion underneath less. So what I'm doing, I've got my hands together with my knuckles inside, and I'm pulling it further apart like you would do if it was straightening out. So when you do that, you help the lymph flow back through.
It's kind of like
And
kneading dough and improving the elasticity of the dough through kneading.
yes. So then what I do is then there's acupuncture points that you do above and below the scar. So you go above the scar, but you do an acupuncture point that's below the scar to tie things back in energetically. And then you do the same thing on the other side. So you go below the scar and you do one that's you do a point that's above the scar. So you tie things back in energetically. So, I mean, there's you do it 3 times, you crisscross, you can go straight through it. I've worked on burn scars. I've worked on mastectomy scars. I've worked on lumpectomy scars. I've worked on gallbladder scars. I've worked on breast reduction scars. I've worked on tummy tuck scars. I've worked on flap scars. So, I mean, and I love that work. I love it. Some people, the scar changes color. So the very first one that I did, I'm showing my fist. And my boyfriend had on the top of his fist like a circular scar. This was my very first, several years ago, introduction to this work with the scar work. And so it didn't bother him anymore because he was so used to it, but it was not very discolored, but there was a little bit of discoloration and there was an adhesion. So it was harder for him to have flexibility in his hand.
Yeah. And that's the
Sure.
thing that a lot of people don't know about scars until they have one, is
Hmm.
the adhesion where it makes it difficult to move because the
Right.
skin is so tight.
And you think about it, if you've had that scar for years, you've gotten used to it. You don't think
Mhm.
about it. So I got to watch that scar. I worked on it and I got to watch it over the next week change. It changed in color and then he could move his hand more. He had more
Wow.
flexibility in his hand and he was like, I didn't even realize how little flexibility I had until you worked on this scar. So, the scar work just, I mean, it changes things.
Yeah.
You think about it energetically. You have a C-section. Your energy's been cut in half.
Yeah.
Your top half of your body have been separated from the bottom half.
Yeah.
Personally, when you have a mastectomy, one half of one side, if you have a single mastectomy, one side of your body has been cut in half from the top, separating the top from the bottom.
Yeah.
So to energetically be able to help you lessen that adhesion and have more range of motion, have more flexibility, and then to use the acupuncture points to tie it back together energetically to the
Yeah.
rest of your body. I mean, think about, I wish I lived in Michigan so that I could help you and another friend of ours because, even though it's been years, I've seen women. I have one client. Her kids are in their 30s. I think she's got one that's 43. She had a C-section, emergency C-section in the emergency room. Like, we're not talking like in labor and delivery emergency. We're talking emergency room, emergency C-section. There is no uglier scar than an
Yeah.
emergency
Yeah.
scar.
They're trying to save 2 lives at that point.
Right.
The scars don't matter.
Right. So, but to see her walk more upright when she walked out of the office just after one session, not completely, it wasn't completely, the adhesion wasn't completely gone, but to see any improvement and for her to say, "Man, my back doesn't hurt as bad." I mean,
Really?
it's amazing work. I love the scar work. So yeah, so I've taken their breast class where they actually show you how to do all of that and intertwine it and all the little points for how to help with the different things.
So there are 3 things I want to talk about. Number 1 is there is a tool called the activator that some chiropractors are trained on how to use. And if
Mhm.
you need, it sounds like the activator and the tool that you use are very similar because they work without manipulating the body. You just push on a pressure point. My chiropractor uses the activator because I don't want to be twisted and turned anymore because of my health, right?
Mhm.
I don't want a manipulating chiropractor. But I want chiropractic work. So I just wanted to mention that. Okay, that was 1. 2, the house next door to me is for sale. I'm just saying.
Full
You wanna be my
disclosure,
neighbor?
Candace has been trying to move me to Michigan with her ever since she moved up there.
There are a lot of benefits of moving to Michigan. A lot. Number 1, no hurricanes.
True.
3. Okay, I wanna talk about the tool. So if you are in the greater Houston area or West Houston, Northwest Houston, you want this work done, Christy is available. She has a mobile business, right? So
Yes.
her contact information will be in the show notes. However, the tool is available nationwide through
Mhm.
is it a tool that you can only get if you're a practitioner?
No, actually, you can purchase it for home use.
Really? So if you don't live in West Houston or the greater Houston area and you would like to find a practitioner who uses this tool, do you need to ask? What do you need to look for in terms of finding the tool?
Is it okay to say the name?
Yeah. Yeah.
It's a Dolphin MPS, Dolphin Neurostim, and
Dolphin Neurostim.
it's actually out of Canada.
Really?
Yes.
So it might be a little more difficult to purchase right now.
No, you can still get it. I just got mine a couple of months ago.
So if you don't have someone nearby, it is available. They are not cheap, but there'll be a link. Do you have an affiliate link for Dolphin?
I do not. They do
If
have a practitioner link, though, where you can find a practitioner in your area on their website.
Oh, perfect. So I'll link to the
Yeah.
practitioner link in the show notes. So if you're looking for a practitioner, there'll be a link to that.
Yeah, it's like reflexology. Like, I'm not going to do my own reflexology. I'm going to find somebody else. You know.
Now gotta get back to my questions. All right. Imagine that it's 10 years from now. And let me tell you, I've been in this cancer thing for 12 years now, so I've seen some huge changes. How do you foresee holistic health practices evolving in the next 10 years, in the next decade?
I would hope that holistic is going to be more incorporated into what they're recommending for people, not just the 2 major things that they recommend for people at this point. Wow. I have no idea. Like, things have changed so much. I mean, back when my mom's best friend was diagnosed, like, they didn't really talk about anything other than, chemo and cutting. I mean, I don't know. Who knows? In the future, there may be tools that help get rid of things without having to cut, or maybe
Well,
the.
there are tools now. There's radiation, there's chemo, but the standard of care for a tumor is to
Mhm.
remove it.
Right.
If radiation and chemo don't shrink it so that it's non-existent, it's
Mhm.
removed so it doesn't grow. So yeah, I mean, they've been moving towards that. So any woman who's ever given birth will occasionally pee when she sneezes. Every woman. And I don't care. You can tell me till you're blue in the face that you don't, but if you've given birth, you probably pee a little when you sneeze. All right.
Mhm.
And something that they do in Europe, which is a standard of care, is pelvic floor therapy. So you can ask for pelvic floor therapy in Europe. It's covered by the insurance, and you can have that treated. Pelvic floor therapy is not a pleasant treatment. It involves,
Okay, Candace, but you know what?
yeah,
With the Dolphin Neurostim,
you can fix that.
they literally just came out with a protocol for incontinence.
Really?
Yes.
Really? See, so this is my prediction. So for decades, women don't even talk about it, right? Women have not talked about it. It's just an embarrassing secret that every woman has that they're
Mhm.
too so embarrassed to talk about that most women didn't know that every other woman has the same problem. All right. And I'm going to tell you that it's 99.9% of women who've given birth and will occasionally pee when they sneeze. Right. Okay. And it may happen once a year, whatever. Right. But it's because you gave birth. Okay. So now in 2025, it is a lot easier to have that treated,
Mhm.
right? The technology exists, and the technology has existed. Oh, biorhythm, they have a little tool that measures your muscle. It's very invasive. It's very invasive treatment. But it's biofeedback. So it's a biofeedback, and
Mhm.
biofeedback has been around since the 80s. So, yeah. Okay. Anyway, so my prediction is that because things like biofeedback are now my family practice doctor actually prescribed this for me, right?
Okay.
All right. I think that and my oncologist talks about acupuncture, and when I first came to this new doctor in Michigan, I was asked if I wanted a marijuana card, right? So marijuana for the
Oh.
nausea
Mhm.
and the pain, right? So things are moving in the direction of both, right?
Mhm.
We're going to treat you with chemotherapy, we're going to treat you with radiation, but here are some other options for you. So
Right.
I think that in 10 years, there are going to be a lot more complementary opportunities for people that are actually prescribed by doctors. I don't
But
know if insurance will cover them, but at least I think doctors are learning about these modalities and how they work and how they help. Okay, add
but
to
the
that.
incontinence protocol with the
Yeah,
Dolphin Neurostim is
is
not
not invasive.
invasive. Nope. It's not invasive at all.
So it sounds like this tool is pretty amazing.
Mhm. I love it.
And it's, there are still people who are hesitant to go to an acupuncturist because
Mhm.
it's very woo, even though I believe it works, but this is a medical tool. It's a medical device, you know?
Yeah.
Yeah.
It is. It's awesome. And
Awesome.
it's small. It's probably the case that it's in is smaller than my laptop bag.
Oh, wow. So it's a small tool.
Yeah. It's not a big tool. It's not anything scary. I can show people on the parasympathetic points like what it does.
Yeah.
So, yeah. You can
Yeah.
even
And
do Vegas stim with it.
wow. And oh my gosh, what I have learned through the Super Patch Company is how important that vagus nerve is. If your
Mhm.
vagus nerve is healthy, everything's healthy. And if it's
Yep.
not healthy, you got problems everywhere.
Mhm.
So, but the vagus nerve is on the back, right? Or is it in your
Starts
back?
behind your ear
Starts behind your, so you could treat it behind the ear, but it goes all the way down.
because
So
it's one of your cranial nerves, I think is what they call it.
so it starts right here,
Yeah, it starts behind your ear.
like behind your earlobe.
Mhm. Yeah,
I wonder if that's my shoulder problem.
could be.
Interesting. Okay. All right. It is time to wrap up. Wow. I
Did
love
we
getting
get
to
through all your questions?
we didn't do the rapid fire questions that I was supposed to at the beginning because I was so squirreled. So let's do the rapid fire questions. Are you ready?
Yes.
Coffee, tea, or something stronger?
Coffee.
Me too. Do you put
Coffee in the morning, tea in the afternoon.
excellent. Are you a morning person or a night owl?
I'd be a night owl.
One word clients use often to describe you.
Kind.
That is the best word. You are absolutely a kind person. And I love this question. If you were not in holistic therapy, what would you be doing?
Have no idea.
You love what you do.
Didn't plan on going this direction.
You know,
I don't know. Something helping people, I'm sure.
yeah, absolutely. Something that most teenagers don't understand is that none of us, or very few of us, actually end up doing what we think we're going to do. But you end up doing what you need to do, what the world needs from you. You normally, and you can tell. I mean, there are people who are not aligned with what they're doing.
Oh, yeah.
But for the most part, we end up doing what the world needs us to do. Okay, Christy going. This is your moment of gratitude. What is one moment of gratitude from your work with clients that stays with you?
When people tell me how much I've helped them.
Do you want to expand on that?
So he's deceased now, but I had a client who I did massage, and going back to your aromatherapy, he was diagnosed with a tumor on his pituitary gland. And he said, "Is there anything you can do?" He said, "What about those oils that you use?" He was a little bitty short, older gentleman. And I said, not without talking to your doctor. And I thought there is no way that this doctor is going to talk to me. And I called. Got me the information. I called and told him what I wanted to, what oils I wanted to use. It was super simple. It was frankincense and apricot kernel seed oil. That's it. And they said, yeah, that would be okay. So I fixed him a bottle. And, when he went back in 3 months, the tumor was gone. Yeah.
Man,
So, and to see an older gentleman get tears in his eyes when he was telling me because he was so happy that it was gone, that is just amazing to me.
so we need to disclaimer here that he was also doing other treatments as well, right?
He was doing whatever his doctor told him to do. I'm not sure what they told him to do.
Okay. Because we can't say that frankincense cures cancer.
Yeah, no, I mean, it wasn't a very big tumor on his pituitary gland. It wasn't, but I was actually impressed that the doctor said yes, it was okay.
That's
So
awesome. That is
yeah,
an awesome story. And I'm sorry I talked over you, but usually I end the episode or end the conversation with the moment of gratitude. But sometimes you do need to have a disclaimer. And I love frankincense oil, but we cannot say that it cures anything because there is evidential there is a lot of not evidential, but what's this when there's people who anecdotal. There's a
hmm,
lot of anecdotal evidence to the curative properties of frankincense, but there has never been a study. There's some stuff on the NIH website, but there's no definitive study. But that doesn't mean that you shouldn't try it, because I think you should try almost anything. I've made my opinion on coffee enemas quite clear. Aside from coffee enemas, I think you should try anything.
I think it goes back to what we said in the beginning. People have to do
Yeah,
what they feel is best for them, right? I mean, do the
yeah,
research. Do your
yeah.
own research.
And you know what? Something might work great for me, if it doesn't work for you. Something works great for you, doesn't work for me. And that is the beauty of having a menu of different options, right? There is
Hmm.
no freaking way I would ever order liver and onions, but if it's on the menu at a restaurant, my husband will order it.
Right.
But I won't touch it,
Me
right?
either.
So we have to listen to our bodies. I mean, that's my advice as a patient, but Christy, I'm going to give you the last word. What's your advice? If someone is facing a breast cancer diagnosis right now, or just needs to take better care of themselves right now, what's your advice?
Just do it. You intuitively know what you need to do. It's like we talked about with the hand a while ago. I'll tell people this point is the point on your hand, and people will say, I've been wringing my hands. You intuitively know. You intuitively know if a job is toxic for you, if someone in your world is negative and you need to distance yourself from them. Take care of yourself. Like whatever it is, and just take tiny steps. I'm not saying change your complete world drastically. Take baby steps. If you need to get up and exercise, do one sit up, one squat, walk to the mailbox. It doesn't take huge things to make a difference, but everybody knows intuitively the things that they need to do, and I think that it's important that you listen to your heart.
Thanks for tuning in to Gratitude Geek, the podcast for micropreneurs building genuine, lasting connection with clients, colleagues, and community. Our theme music is by Rev Brock and Soul Lily. I've been your host, Candice Rodarty. Stay groovy, my friends.
Stay groovy, my friends.